I'm going to go over the equipment that I use when I'm doing reprocessing with a client. So we have tappers here and we have a light bar. I also have headphones. So first, I'm going to show you the light bar. The brightness can be adjusted to any level. The colors, I've got white, purple, blue, there's cyan, green, orange, yellow, and red. Most people like the purple, the white, or the blue. And we can also make it to be very wide or pretty small. It's always what's going to be the most comfortable for you. We also have options to get your eyes moved back and forth through either blinking or sweeping. So this is blinking. You can see it going back and forth. And then we have sweeping. The whole point of this is for you to follow your eyes back and forth. That's all that matters. And we will find what feels the best for you so that it feels good going through this process. Eye movements are used in generally all cases. It's the gold standard. However, if there's eye issues, eye pain, seizures, migraines, we are not going to use the light bar. I don't want to cause any harm. So we'll use tappers. And these are these two fellas here. So pulsing is all about how intense it can be. It can be pretty hard. This is about 50% right now. And I can actually make it go even softer so it doesn't feel as buzzy in the hand. Again, it's about what's more comfortable, but you have to be able to feel it. You will hold them in your hands or you can tuck them underneath your legs. Again, it's a matter of what's going to be more comfortable for you. The other option is that people often like to have them both together, the light bar and the tappers. One reason for it is that let's say you're having a pretty emotional experience and there's a lot of tears. This is normal and very healthy, by the way. Sometimes you just want to be able to close your eyes, and it's hard to watch a light bar and cry at the same time. So these are a wonderful piece that really help clients to be really engaged in the process, to feel their feelings without, not reprocessing. Because the minute that you close your eyes, you're not reprocessing any longer. So you'll need to have the tappers. Earlier, I mentioned headphones. Headphones are another wonderful piece that we can add to this wonderful puzzle. For clients, it can be just simply they really like to hear the tone and that is helpful for them. I also find they're really helpful when there's been an auditory trauma, and this just isn't quite cutting it. For example, let's say you were in a car accident and the channel that we're going down right now is around the sound of the two vehicles smashing together. So you're just hearing that metal on metal smashing. Using the headphones and having that audio tone going back and forth this way can essentially help to resolve and dissolve that trauma so that that channel is cleared. The whole point is really to get you comfortable so that when we go into reprocessing, we know exactly what we need to get this whole outfit set up so we can jump right into reprocessing.